I rise this afternoon to join my colleagues in this debate on Bill C-20, and I'd like to thank our colleague, Senator Moncillon, for her presentation and her excellent answering questions in the chamber today. I support this legislation. I support the decision to provide a one-time payment to persons with disabilities for reasons related to COVID-19. I also think that changes to certain acts to increase the flexibility of time limits as a result of the pandemic are necessary. Bill C-20 also includes major changes to the Canadian Emergency Wage Subsidy, which was first put into place in the period from March to June and providing a 75% wage subsidy to some employers. The changes to this today include the elimination of the revenue threshold and tying the subsidy to actual revenue loss, the extension of the program until December 2020, and increased benefits for highly impacted firms. This bill ends the 30% revenue decline as a threshold for obtaining the subsidy and introduces a sliding scale mechanism that calculates wage subsidies as a percentage of revenue lost. Of course, this makes a great deal of sense, and I have to wonder why this aspect of the program was not included originally. It does seem to make so much sense to do it that way, and it's a bit surprising that we would have to wait this long for this change. But nevertheless, the change is now here. The revised program also anticipates a gradual reopening of the economy where the benefits received decline over the course of the subsidy program as revenues are expected to increase. The second change to the program contained in this legislation is the extension of the program until December 2020, a full 4 months longer than the previous August end date. Ending the wage subsidy program too early could very easily undo the benefits of the federal government's investments in the economy so far. The longer run time of this program, combined with the slow phase-out, should reduce the financial squeeze that firms will experience as they transition away from the subsidy. And finally, this legislation includes a top-up for those businesses most affected by the pandemic. Companies that have experienced significant revenue decline will qualify for an additional wage subsidy equal to a percentage of the loss they've experienced. Those firms hardest hit by the lockdown will be able to receive an 85% revenue subsidy in the near term, a total that would slowly decrease both as revenues increase and the program phases out into December 2020. Senators, I had my career in the private sector. I understand what it's like to live with uncertainty. In running a business, you can have significant revenues and still be out of business in 12 months. Or you can have moderate revenues and be out of business in 6 months. That's what it's like running a business and operating in a competitive environment, and especially so for small and medium-sized businesses. But I also have to say that during my career in the private sector, building a company, I never experienced anything comparable to what businesses are going through today. The work of a lifetime could be gone in a few weeks or a few months through absolutely no fault of their own. That is why we have to support our businesses to keep going and to keep their workers and employees on the payroll and to keep their companies afloat. Their feelings of vulnerability will still be there in this volatile environment, but at least their jobs and their businesses will be saved. The sobering and substantial cost of this program, almost $84 billion, reminds us of how huge the losses are. And let us also not forget that 5.5 million Canadian workers were impacted by the pandemic between February and April. 3 million jobs lost and 2.5 million lost 2.5 million Canadians lost work hours. Even as we assist Canadians and start to rebuild, we are constantly reminded that the pandemic is an economic crisis as much as it is a health crisis. Now, let me turn to some thoughts about this health crisis. Over these past 5 months, Canadians have found our way through the worst of the pandemic. People have practiced physical distancing, have given up seeing family and friends, have taken their children out of school and childcare, have left their workplaces to work at home, and much more. The federal government has provided massive financial supports, and the provinces have taken up the challenges of managing health care, education, and the labor force in a crisis environment. We have learned a lot. The Senate Standing Committee on Social Affairs, Science and Technology, of which I am a member, in assessing the government's response to COVID, has learned that seniors, healthcare workers, essential frontline workers, and people with mental health conditions have been especially vulnerable. In particular, the pandemic has exposed the huge weaknesses in our long-term care sector. Many long-term care homes, for example, do not have the capacity to isolate sick patients or to allow for physical distancing. Residents have died as a result, many residents have died as a result, telling us clearly that we need to take action. We also learned at committee that Canada is not well prepared for a second wave of infections, and that we need better diagnostic testing and contact tracing if we are going to contain the rise of new cases. We learned that the federal government needs more data, yes, data, more detailed data, to inform the development of evidence-based policies as we go forward. And many witnesses at committee called for more federal action and leadership. Now, presumably, in response to these concerns, the federal government has recently committed emergency funding for the provinces under the so-called Safe Restart Agreement, announced on July the 16th. From the limited information I have read in the media and in a short release, we have learned that $19 billion will go to provinces and municipalities to increase testing and contact tracing, to build capacity in healthcare systems, assist in the procurement of PPE, support seniors and other vulnerable groups, help in providing childcare and other activities. Now, had the minister been here today in Committee of the Whole, and I have to say I'm very disappointed that we did not have Committee of the Whole today so that the minister or ministers could be here to answer questions. But had one or more ministers been here today, I would have asked about this program, since details of the Safe Start Agreement do not appear to be readily available. I would have asked whether the promised funding is tied to specific outcomes in specific areas. And I would have asked whether the agreements required information collection and data sharing between the provincial ministries and federal departments and agencies. The lack of data and information is not an issue unique to long-term care, unique to the long-term care sector, but it is particularly important here, given the many calls for federal action in this area. We need to understand what actually affects outcomes, which means collecting data on the entirety of the sector, on staffing levels, staffing qualifications, resident demographics, resident health statuses, the rate of informal care from families, additional private care, hospital visits, and so on. And this information must not stay within the facility, as it often is today in many provinces. It must be shared by health authorities to inform efforts to compare long-term care across regions, provinces, and the country, and to facilitate policy development and a better regulatory framework. Witnesses at our committee urged the federal government to make sure that its funding is tied to real improvements in specific areas. Otherwise, federal funds are always easily diverted elsewhere. So we have heard that point time and time again, and we have to make sure that this happens. In recent weeks, we have seen an uptick in COVID cases, coinciding with the reopening of the economy in many provinces. And we have also seen increasing concerns about COVID on the part of Canadians. New polling by the firm Leger Marketing has found that levels of concern and levels of worry about contracting the virus among the public have recently increased, and those concerns are back to the same levels that we found in April. Canadians expect that we have learned from the policy missteps and successes of recent months, that we understand the issues better today, and that we can deal with the second wave, if it comes, effectively and confidently. In my view, Bill C-20 is good legislation based on lessons learned and responds well to the situation we find ourselves in today. Thank you very much.